Hello everyone, I'm Dr. Ashwin Tamankar. I'm a consultant urological oncologist and robotic surgeon. May month is considered to be bladder cancer awareness month. That's why we're discussing a series of bladder cancer pathway diagnosis to treatment. Now we're talking about treatment of bladder cancer. Essentially, we divide those into non-muscle invasive cancers and muscle invasive cancers. In a non-muscle invasive cancer, the intention or the goal is to preserve the bladder. So essentially, the treatment starts with the first procedure which we described earlier called as TURBT, transurethral resection of the bladder tumor, which confirms the cancer and proves the depth of invasion, which must be, of course, falling short of muscle layer. In that case, after the TURBT is been done, we actually stratify the bladder cancer patients into 4 risk groups. And based on the risk category, we take things forward. For a very low risk, probably we may not need extra treatment, but just a surveillance by doing regular cystoscopies to evaluate bladder at regular intervals. In an intermediate or a high risk category, we need something or the other to be instilled into the bladder by giving some therapy. The intention of this therapy is to minimize 2 types of progression. One is recurrence, another is progression. Recurrence meaning the cancer coming back again and again. Progression means the cancer coming back with a vengeance, meaning little aggressive mode than what it was earlier. For example, earlier low-grade cancer turning to high-grade or early superficial cancer going into the deeper layers, that is called as progression. So to minimize the chances of recurrences and progressions, we give some therapy in the bladder in an intermediate and high-risk bladder cancer, which is non-muscle invasive stage. What kind of therapies are these? One is intravesical immunotherapy, also called as intravesical BCG therapy, which is the gold standard and being described since ages. And the another one is intravesical chemotherapy. So even if this is a chemotherapy, it is given inside the bladder of the patient by an expert. So either intravesical immunotherapy or BCG or intravesical chemo are the options. There are designated cycles and schedules of it. There are designated ways of giving it, and some patient who is on these type of therapies also need to be simultaneously put on surveillance every 3 to 6 monthly for some basic evaluations including camera tests, cholecystoscopies, and some urinary tests to ensure that the cancer is not coming back. Both intravesical chemotherapy and immunotherapy come with some consequences. That's why it needs to be discussed at length with the clinician for decision making. Thank you.